without handing this over to government. Let me whip off at least a half a dozen. Allow the creation of association health plans. This will allow small employers to come together and form large purchasing pools, such as labor unions and large corporations. You can join through a Grange or your Farm Bureau or National Federation of Independent Business, even through your organization, if it's been around for at least 3 years and it's shown it can be responsible. That will greatly enlarge the number of insured. It will do away with pre-existing illnesses as a bar to insurance, and will bring down the cost of health and accident insurance. Second, expand tax-free availability to health savings accounts. How many here have HSAs? Good number here. Those will be eliminated if this bill is put into effect. 3, expand small business tax deductions for health care expenses. Mom and pops are not allowed to buy health insurance with pre-tax payroll, with pre-payroll tax dollars. If they were allowed to, that'd bring down the cost of health insurance by 15.6% off the top. Create refundable tax credits to help low-income Americans purchase health insurance. Many people should be given the option to pay income tax and buy health insurance. It simply makes sense. That way the government's not directly involved. Preserve the high-quality care of America for America's community health clinics. Crusader Clinic in Rockford last year saw 46,000 people. They deliver 1 out of 4 babies and have one of the highest rated clinics in the country. 5, reforming our out-of-control medical liability system. There's not one word in this bill about tort reform. Nothing to bring down the high cost of medical liability insurance for the Americans. Create incentives to save now for future long-term health care needs. Create a high-risk pool for those who are maxing out on their $1 million caps on health insurance. These are not hard to enact. Twice the House passed association health plans, and it missed a vote in the Senate, missed it by 2 votes, and therefore it failed. Twice the House passed reasonable medical liability insurance. Each time the Senate did not bring it up. That's because you need 60 votes in the Senate in order to move the bill.
Thank you, Representative. Go to the next question. Our next question is Ms. President. One issue at the center of this debate is rationing. It's clear that Americans just don't like the sound of it and categorically reject